Let's get into the papers now, see what the headlines are. But certainly I have with me in the studio to do justice to this, I have Funke Treasure here with me. Funke, good morning.
Good morning.
Good to see you.
Good to see you.
Great. And I also have OladeindeAriyo here with me, one of our regulars as well. Good morning.
Been a while.
Well, it's good to see you though.
Same here.
Great. Now let's get started from the Blueprint newspaper. Blueprint says, after 44 years in operation, NNPC ready to declare 2020 dividend. GMD is saying this. That's the Blueprint newspaper. All right. After 44 years in operation, NNPC is ready to declare 2020 dividends. Okay. From there, let's go to the national economy. All right. That's the Blueprint. National economy says Nigeria risks reduced oil production in 4 years of a contentious PIB. Output could drop by 250,000 barrels by 2025. That's the national economy there. Business Day saying companies navigate COVID-19 third wave to stay open, protect staff. Companies navigate COVID-19 third wave to stay open and protect staff. Of course, we'll be talking about this COVID stuff as we open discussions. The Guardian newspaper is next. Guardian says after $75 billion investment in 20 years, telecom service still struggling. Subscribers decry increase in drop calls, slow data operations, lack of FX insecurity, cut operators expansion, upgrade plans. All right, all of that are some of the reasons given there. That's the Guardian. Daily Times is next, and it says 2023 APC PDP knock Jega over advice to Nigerians. Daily Times. All right, his outbursts on us wrong, untenable. The governing party is saying that, and the PDP queries ex-INEC chair's judgment, says that the APC Buhari failed Nigerians. All right, it's a back and forth there on the political front. That's Daily Times. First News is focusing on APC Al-Makura's chairmanship ambition in jeopardy. All right, that's what First News is saying as his EFCC case raised ethical question. Okay. That's First News. Daily Trust is next, and it says Buhari mum as APC weighs options on Buni committee. Cracks widen, uncertainty prevails. And caretaker committee meets today. Oshibajo others continue search for solution, and danger ahead. Lawyers are warning. Danger is ahead. That's Daily Trust. Leadership newspaper is next. Fallout of Supreme Court judgment. Oshibajo APC governors, ministers explore safe options. Oshibajo APC governors and ministers explore safe options. Buni committee is Keyamo's brainchild. Omagige is saying this. I was only consulted to fashion a way forward for the party over barrage of litigations. As the minister is saying that. That's leadership. The Nation is next. Oshibajo's team working on ways out of APC's legal ditch, while last-minute attempt to postpone ward congresses was stalled. All right, that's the Nation newspaper. Okay, from there, the Punch newspaper is next, and rising COVID-19 cases, right? And it says the NESG, LCCI fear fresh lockdown. Federal government plans tough actions against the third wave. Another lockdown will shrink government revenues, affect private sector citizens. NESG is saying this, the Economic Summit Group. Sanwo-Olu cries out over daily COVID-19 deaths, says red zone travelers abscond. Nigeria takes delivery of 4 million Moderna vaccine doses from the United States. All right, mark this one. Sanwo-Olu cries out over daily COVID-19 death, says that red zone travelers abscond. Okay, that is to say, people who come in from the countries that are not supposed to, they are not supposed to be that is on ban or on suspension. Sometimes they They show up and then they disappear somehow. We'll talk about this. All right. The Daily Sun is next. COVID-19, 30 die in 7 days in Lagos. This is really traumatizing, as usual. Sanwo-Olu flashes red flag, says state recording 6 deaths at isolation centers daily. 4,300 confirmed cases in July. We're yet to see worst of pandemic. Federal government is saying this. Delta variant cases hit 32 across Nigeria. Oh, this is troubling. All right, this day is next. Federal government, Nigeria officially in third wave of COVID-19 pandemic. Receives 4 million doses of Moderna vaccines from the United States. Issues new safety protocols for diplomats. Lagos recorded 4,300 new cases, 30 fatalities in July. And that's the governor, Sanwo-Olu, saying that. NCDC warns Delta variant may spread to more states. And the resident doctor strike already disrupting hospital services. All right. Nigeria Tribune is next. It says COVID-19, Lagos, Oyo, FCT, 4 others on red alert as third wave rages. 4.08 million Moderna vaccines donated by the United States awaiting efficacy test by the NAFDAC. Don't take Moderna if you've taken AstraZeneca, Sanwo-Olu wants. The federal government puts enforcement committees in place at airports. Okay, that's the Nigeria Tribune. Okay, Daily Independent. Striking doctors vow government must fulfill 10-year memorandum of action. Daily Independent. Striking doctors vow government must fulfill 10-year memorandum of action. Sanwo-Olu raises red flag as COVID-19 cases surge in Lagos. Akwa Ibom orders 1 million doses of coronavirus vaccines. The federal government raises the alarm as Delta variant hits 6 states. That's Daily Independent. All right, the last one we're looking at now is the News Direct. News Direct says nationwide strike, resident doctors shun stranded patients as relatives seek treatment in private hospitals. No work, no pay directive will not work. That's the National Association of Resident Doctors saying there. Okay, that's News Direct. Okay, gentlemen and lady, let's look at this issue here, COVID-19. I think this day puts it in perspective. Nigeria officially in third wave of COVID-19 pandemic. I recall that we've been talking about preparation for third wave, you know, what we should look at, what we shouldn't look at, what we should do, what we shouldn't do. But it is here now. From the figures that are going up, 200, 300, 400 daily infection that we are seeing, it tells that maybe we're back there again. Oladeinde, what do you make of this?
More than at any other time, Nigerians have demonstrated their uncaring and careless disposition towards COVID-19. Even if we will say we've been blessed with a tropical weather, sunny environment and all of that, and then we've not had it as bad as other nations, it still does not mean this thing is not here with us. If some people didn't know directly some victims of COVID-19, but they knew them in public space, senators died, governors died, popular people died, they died. And I don't now know what they were waiting for them to start taking this thing very seriously. What do you find? When you go to a public place like a club, I won't mention a name now, the security men there, they now sell face mask because more people troop in without face mask. So for them to gain entrance, they usually sell even at the entrance into banks. That's what you find now. And for me, it's not the way to go. Remember again that we've been talking about public education and mass enlightenment over all of these things. the only ones you get to see are on the internet when you go to social media. But the local radio, TV, all of that here, they've been lacking in raising the bar, whereby letting people know, drumming it into their heads that, look, this thing is real. It took the governor yesterday to come out, Governor of Lagos State, to come out and say, look, it is no longer a laughing matter in Lagos State. So I don't now know what has to be done to let people know that it is no longer game time, so that they can begin to do the non-pharmaceutical preventions, washing hands, wearing masks, and all of that.
Okay. Funke, I wonder what you make of this. He said, Oladeinde is saying that, of course, enlightenment has to be done more. I wonder if people are not enlightened. There seems to be some level of information fatigue.
I was just
it is just too much there that is of no effect anymore. Something
too much.
Is that what we have?
I think we're all suffering from that information overload, fatigue. The orientation agency, Oladeinde's friends, are not up and doing. They also got tired along the way. And as I'd always criticized them, they didn't use the medium of mass communication. You cannot be on the internet. By the way, they said they were on Twitter. Twitter had been banned. So what
you're referring to the National Orientation Agency? Oh, they're best friends too.
I will defend them.
So there is that discontinuation or lack of continued awareness. Then there is this lack of enforcement of restrictions, which is what the papers are reporting today, that some of the travelers from the red zones are not available for
abscond.
They just abscond.
From what the governor of Lagos has said.
Then again, importantly, there's the continued shaming of COVID-19 patients, of survivors. Yesterday, I listened to the account of a woman whose husband is still at the isolation center. And she said on radio, I don't know why people said this particular actress died of other causes. I saw her. I was there. So it tells you that there is this shaming, there is this what do I call it? Stigma. Thank you. There's a stigma attached to those who suffered.
People still don't want to come to say, okay,
they don't want to say, okay, this person died of COVID. I don't know why we're doing that as a people, because at the end of the day, we're hurting ourselves. We're hurting the society. And then you look at people, Lagos State had a law. If you're not using your masks, you're going to pay this X amount of money. No enforcement. If you go to the markets, the market women don't believe there's anything like COVID. So there are places where you can just pick it up. Community spread is still ongoing, and all of us are going on as if nothing is happening. So I am not really surprised that we've had a surge. It's a good thing that the Lagos State's governor has remained proactive. We must give it to the governor. He's remained proactive.
Lagos has been really exceptional.
Look at what he said. He said 30 deaths in 7 days. That's alarming already. Delta variant, we've already had 32 cases. It's spreading. And the danger in the Delta variant is that you don't see it coming. It doesn't show up. You just have it and you don't know that you have it, which is even more dangerous. So we all now need to exercise personal leadership in taking care of ourselves, in continuing with the washing, just as Oladeinde has said.
Those non-pharmaceutical precautions and protocols.
Yes.
Okay.
And we must go out. People like me who haven't been vaccinated for one reason or the other. We just heard that if you haven't done AstraZeneca, you can do Moderna.
You've been waiting for Moderna, is it?
No, really.
Remember that I said that as public people, we should hear on this platform be vaccinated before the camera.
Of course.
It was the
so that's what you're picking up.
Let me also say this. I understand that over 4 million people in Nigeria now took the first dose, and slightly over 1 million are taking the second dose. Not minding that by the timing and the arrangement, they were already due for the second dose. This again brings us back to the fact of people not being very well enlightened enough to know that it's not about the government, it's about you, it's about your life, it's about your well-being, or the alternative, death. Because what is that thing that will make over 4 million line up for the first dose, especially when they knew that there's a second dose, and then at the appropriate time, they will refuse to turn on. Okay? Now, yesterday I listened to different platforms. Somewhere they said, if you are taking AstraZeneca, don't come near Moderna. Okay? But the other guy said, you can take a third option or whatever. And I was like, look, let's not confuse people. Let's just leave it as it is. You either go for Moderna or go for AstraZeneca.
Unfortunately,
because we are largely,
I think information,
the quality of information that is in the public space, they are not encouraging.
Yes. Yeah, but the danger now again is that doctors are on strike. They started their strike yesterday, so this is not good for the third wave that the government is crying out about. And I really don't understand why we treat our doctors, our health workers like this. These are strange times. This is the time where we need their services, and we can't really be bothered whether they're paid or not. That's not fair.
If you need to pamper them, why not go ahead and ensure they render their services? But the resident doctors are still talking about a 10-year-old agreement that they have signed.
Really don't think anything to us. It's not fair.
And all the news platforms, doctors strike. And I was like, why can't somebody in government somewhere see the need to immediately address all these decade-old grievances? I would have been happier to see the doctors saying we are going on strike because the president is going abroad for treatment. That would have made a lot of sense to me. Okay, what we are facing now, they will be moving out of Nigeria, and it's painful. Go to the US, go to any corner of the world. Nigerian doctors are doing very well. Why can't we retain them at home so we can enjoy the benefit of training them?
Do you know what? This is why I like what Jega is saying, that we should discountenance the two parties, because they really don't care about the people. What is governance when you're not an empathetic leader? You don't care about your people. The doctors are leaving. The doctors are on strike. You don't care. Security, failure, zero for months now. I support Jega. Jega for president.
Let me ask Funke.
Please don't go that route now. Don't go that route now.
We have enough time. We have independent candidates. You see, we, the people, must take our lives in our own hands. We have seen, the PDP, the APC are adrift.
Okay.
Both parties.
All right.
So
Funke, let's leave.
Leaving Jega's
Funke, let's leave politics for the politicians for now. For now. There'll be time for us to discuss politics and talk about what one party is not doing and whatever. On Sunday. Okay, I won't be here certainly. But the point there is, since the beginning of COVID-19, and countries have been doing everything they can to purchase vaccines for their countries and for their citizens. Nigeria has made all efforts. We've not been able to purchase anyone yet. The one we've been receiving has been donation.
I mean,
Govt, 3.9 million or about 4 million doses was donated. Now the AstraZeneca, now we have another 4 million. All on the donation.
I was going to
Meanwhile, there is this huge amount of money
budgets that we heard. So whether it is monies that we just heard but was not budgeted or was not released, we don't know yet.
What worries me is this: have we become so poor that we can ill afford to pay for vaccines? And then apart from that, we have over 200 million people here. The total vaccines donated to us is still less than 7 million.
Yes.
Or thereabout. Sorry, less than 8 million.
Yes.
And
the
how
implication,
serious are we now?
And the implication is that 7 million doses roughly, or let's say 8 million doses that we have, it's not 8 million people that will take it.
No.
Because it is two doses
per person. Exactly.
So
it comes down to 4 million.
Yeah. So you cannot begin to see that the people are copying the government. Yeah, because you cannot see the seriousness manifesting in the number of vaccines purchased now or even donated. If we got only 8 million, that will serve 4 million people, right? At rate of 2 to 1. What happens to the remaining 160 million people?
What we need the Presidential Committee on COVID-19, I'm not sure if I got the title right. What we need from them is accountability. These sums of money, how was it spent? Which one did we purchase for the people?
We have
more than 200 million people with donations of 8 million doses. What will happen to the 200 million minus 4 million people? We need accountability.
Well, they have been doing a good job of letting Nigerians know. At least they've been speaking to Nigerians on daily basis.
Talk is cheap.
Yeah, but they've been speaking, isn't it?
They have been speaking, but
they've been speaking on what
has happened to the money.
So the point there
These
is
figures are not connecting. And let me I ask again, can't we afford to buy?
All right. We will prepare to buy, of course.
Why are you saying we will prepare to buy?
No, it's in government.
You're not part of it.
It's in government.
We are Nigerians now. Well, we have to leave you here now. Thank you so much, OladeindeAriyo, for your time on the program. It's really interesting with you. Funke, thank you so much.
Thank you.
You can come back for the political discussion on Sunday.
I
won't be here though.
Let's meet here and take our vaccine.
Fine.
Okay.
She will lead the way for.
Great.